there was an individual who was incarcerated, and while he was in jail, now unfortunately his name has not been disclosed. This was an article written in The Atlantic by Joshua Mesrick, who works in the medical industry. And he writes about a man who was incarcerated, and while he was in jail, he was beaten by another cellmate, and he got medical attention as a result of that. Now, while doctors were examining him, they found that he had 2 aneurysms on his hepatic artery, which is basically the artery that feeds his liver. Now, doctors in the jail were basically keeping a close eye on those 2 aneurysms, and they realized, you know what, they're growing and they're putting him in significant risk. So they scheduled him for a surgery in order to remove those aneurysms.
Good.
And before the surgery could take place, he was actually freed from jail.
Oops.
Okay. He goes to his pre-op appointment, and the doctors tell him, you're no longer incarcerated, therefore you have to go get insurance, and then you can get this surgery. If you were a prisoner, then of course, sure, yeah, we can do the surgery then.
Isn't that amazing on so many different fronts? That first of all, like, the average citizen has less rights than someone who's in prison, right? Because we don't have a right to health care, so sad day for us, right? But of course, if we're imprisoning someone, we can't let them die. I mean, that would be indecent, inhumane, right? But at the same time, if you're a regular citizen, yeah, we can let you die. That's not inhumane.
It's so incredible. So he had no choice. He knew that he was going to die unless he had this surgery. He simply did not have the money to get health insurance. So he went to a store. He made sure that an employee at the store saw him stealing a jar of moisturizer and putting it in his pocket. And he got arrested, and he got sent back to jail, and he had the surgery, and he lived.
It's such an indictment of our entire healthcare system. Our system is sick. And conservatives look at that and go, we're number one. We're number one.
Best healthcare system in the world. And by the way, the judge knew what he was doing. When he went to court, the judge was like, what are you doing stealing this moisturizer? Did you really need moisturizer that much? And he explained what was happening. I need this surgery. And the judge said to him, quote, I'll give you 14 months to go get your surgery.
Oh. So, I mean, look, the other part of it that bothers me is that people are getting arrested so they can get health care. Like, I don't want them to do that. That's on our dime, in a sense, right? But the thing that bothers me a million times more is that you got to get arrested to get surgery, to get health care, decent health care in this country. And, you know, whether quote-unquote Obamacare is going to apply to him in 2014 when it finally kicks in is a good and open question that's always complicated. It depends on the situation, etc. But they fought so hard to make sure that we wouldn't get, you know, extra coverage for people like him. They fought, the conservatives and the Republicans did, and really the healthcare industry did, okay, to protect this insane system where an average guy has to go to prison in order to save his life.
I don't really understand, and I've talked to a few doctors about this, and they're usually very much against the Affordable Care Act, understandably so, because they think it's going to hurt their bottom line. But what I don't really understand is how it hurts their bottom line, because in essence, Obama gave this massive handout to these private insurance companies. Mm-hmm. You know, there's absolutely no cap on the amount of money that these insurance companies can charge. And everyone has to pay into the system. Everyone has to buy private insurance. Now we're going to expand Medicaid, right? Mm-hmm. And okay, so that's, you know, government issued insurance. But at the same time, the vast majority of people who never bought insurance to begin with, young people such as myself, will now have to buy private insurance.
Yeah, so it's a very complicated question.
Yeah.
So, you know, might there be a provision that somehow lower some of the payments to doctors? There might be, right? And I don't know. I don't know it at all, yes or no, okay, to be fair on that. But what doctors aren't understanding is that their numbers and their salaries are getting scrunched, not by the government, but by all the giant corporations in the medical industry now. So I've had my doctors complain to me like, I don't know, man, I got the tort thing, and so I got to pay all the insurance, but at the same time, the insurance companies won't pay me as much anymore. And like, yes, they're squeezing all the profits out for themselves and not for you. When are you going to realize that the enemy isn't the government. The enemy is the corporations that are taking all of your money and putting it in their pockets. And look, it's not to say all the corporations are enemy, and there's obviously good that comes out of the drugs that save our lives, etc. So I don't want to be overly simplistic, but all the doctors have now been trained. I hate the government. I hate the government. I hate the fucking government. They're taking my money, right? Like 90% of the doctors I meet are like that. Now, I've met a lot of great doctors who are not like that at all, are wonderful progressives, etc. But look, even good guys, they somehow get propaganda. I don't know if it's at medical school. The government's out to get you, doctors, right? No, you schmucks. It's the insurance companies, etc., that are out to get you. And why? For a simple reason. They're not malicious. They just want a bigger percentage of the profits to go to themselves rather than to you, because that's their job, right? And they're good at their job.